It's allergy season, and also it seems like there's a cold going around at the same time. So a lot of people are coming to clinic because they're having issues with leaking when they are coughing or sneezing. This can also happen when you are laughing, when you're picking up something heavy. We call it stress incontinence. It's a little bit of leaking when you're generating a strong abdominal pressure or an inter-abdominal pressure. So we do something called the bladder brace, which should eliminate the majority of that leaking if your muscles are strong and coordinated enough to do it. The bladder brace is going to use your pelvic floor muscles, which are the muscles here between your sit bones. It's in the saddle area, pretty much anything soft between your pubic bone on the front, your tailbone on the back, or your sit bones side to side. For men and for women, that is the pelvic floor group. So we are going to use those muscles to stabilize and control the pressure. So I want you to imagine when you generate pressure in your abdomen, that strong abdominal squeeze that happens with laughing, coughing, sneezing, or even picking up something heavy, you're generating pressure there. And we can either generate pressure down and out, for example, during defecation or when you're having a baby, you're generating pressure and the intention is for something to come down and out, or you can generate pressure up and out, for example, laughing, coughing, sneezing. When you're getting that little bit of leaking during your laugh, cough, sneeze, it's because the pressure isn't going all the way up and out. You're accidentally sending a little bit down and out. So by pre-contracting these muscles, which I'll explain in just a second, you're going to stabilize the pelvic floor, close off those openings, and force that pressure to go in the intended direction, up and out, for your laughing, coughing, sneezing. If you are looking for those muscles, these are the muscles that control urination, defecation, and contribute to sexual function. They're the muscles in the area of the underwear, the saddle region, and you're gonna find them by trying to contract as if you were holding in gas, if you were holding in urine. If you don't know where these muscles are, come see us. If you think you know where they are, but they're not working, come see us. But if you know where they are, you know how to contract them, and you feel like you can control them, this should work for you 99% of the time to control those leaks when you have a strong increase in pressure. For example, laughing, coughing, sneezing. Just do the pre-contract. The moment you feel that sneeze coming on, do the bladder brace, which is your pre-contraction. Push the pressure up and out as you laugh, cough, sneeze, and then release your contraction. You will have prevented 99% of your leaks.